everything might not be fun.
Yeah, the politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out.
This is the thing. I'm just getting totally unhinged now, and I don't know what to do.
Hey, so it's a snowy day today. First snowy day in 2 years, although not that much snow, but enough that we could actually have a nice snowy run, which is always something to look forward to every winter. I wanted to talk a little about screening tests, because we talked about PSA, and it's really confusing. I've given some talks about it, and in the end, nobody really knows what I'm talking about. It's kind of like I give all these statistics, and in the end, people just look at me like, that's what I get. And I realize how tough this is. Screening tests are tests that you go to your doctor for when you have nothing wrong with you. So in other words, I have patients who come to me and say, I want the works. Give me the works. Give me everything. I want every test you can have to make sure I am not sick. And I say, how are you feeling? They say, I feel great. Every test I give them is a screening test. So when I give someone a test because they come in because they have a stomach ache and they got bowel movement problems, that's not a screening test. That's a test I'm giving for symptoms. If someone's really tired, if they've lost weight, that's tests I'm giving for symptoms. When people come in healthy, that's screening. And screening tests are notoriously inaccurate. They do pick up some issues sometimes. And everybody has a story of someone they knew who, thank God they got that x-ray for whatever reason, because if they hadn't gotten it, they wouldn't have picked up this cancer and they would never be alive today. PSAs are like that, right? There are a lot of people who say their lives were saved because they got a PSA and they picked up that cancer and they got treatment and they wouldn't be alive today. So that's screening. Unfortunately, screening tests are not as good as all that. A lot of this stuff we pick up would never have hurt you if we just left it alone. A lot of the treatment we give you and even the further testing we have to do is very harmful. And in the end, for a lot of screening tests, more people are often harmed than helped. You know, a perfect example is EKGs. We talked about that. You get an EKG, you don't really pick up people with heart disease, but you cause people to have false positives, which then leads to further testing, which could lead to harm. You know, when you listen to somebody's neck, you know, that used to be part of the physical exam. You listen to a neck to listen for a noise. And that noise may represent a blockage. And if that blockage represents something that can cause a stroke, thank God you found it. But it's not that way, really. If you go into a doctor having had a stroke or having had symptoms of a stroke, then maybe those kind of tests are good. But if you have no symptoms, then getting that test gives a lot of false positives. So most people who have a bruit or a noise in their neck do not end up having problems. And you have to sometimes go for more tests. And sometimes even you find a little junk in there and the aggressive doctors try to open it up, what's called endarterectomy. And studies have shown that when you do that, you cause more strokes than you prevent. And also most people who are going to have a stroke don't have the noise. So when you listen and it's normal, it doesn't mean you're okay. That's a screening test. You might occasionally pick up something, but you might also cause a lot of harm and you might miss disease. A good example of that is mammograms. So mammograms, we know, save a lot of lives. People tell us that all the time. People can point to them and say, thank God I got the mammogram. But we know that mammograms are not perfect tests. So I'm going to show you two BRCTs. This first one is how many people who get mammograms all their life die of breast cancer. And out of 1,000 people, it's 4. So this next theater might look almost the same. This is how many people who don't get mammograms die of breast cancer. And that is 5 out of 1,000. So 4 out of 1,000 women who get mammograms their whole life die of breast cancer. 5 out of 1,000 women who don't get any mammograms their life die of breast cancer. That is actually a 20% reduction. That's what the radiologist will tell you. If you get mammograms, there's a 20% less chance you'll die of breast cancer. But in the real numbers, looking at this theater, this is how many people actually prevent dying of breast cancer. Out of 1,000 people who get lifetime mammograms, 1 person does. And the price you pay for that could be large, because about 20% of breast cancers don't actually progress. Some of them will go away on their own, some of them will just sit there. And if we find them with a mammogram and a biopsy, we're going to treat them. So a lot of people are getting radiation and chemotherapy and surgery that is unnecessary because we found these things. And also there are a lot of false positive mammograms. So a lot of women know this. They go for the mammogram and they find something. And maybe they have to repeat more tests. Maybe they have to get a biopsy. The next time they go, it's the same thing. And studies have shown that that causes a lot of stress to people. So about 40 out of 1,000 people end up getting biopsies unnecessarily when they get mammograms. And to a lot of people, that's a big number. So when I have a patient who comes to me for a mammogram and they think they have to get it, but I say, look, here are the numbers, and they've had a lot of false positives, they have biopsies. Some of them look at it and say, you know what, I don't want to get it. Now, we talked about clinical guidelines. We as doctors are graded by how many of our patients get mammograms. So it's in our interest not to tell you that information, just to give you the mammogram. But I think anytime we give you a screening test, we should tell you the pros and cons of that, like PSA, like mammograms, like blood tests. A good example of that is, since we've been doing a lot of CAT scans on people the last 20 years, on people who come in with stomach pain and other issues, we find a lot of kidney cancers. It's called incidental finding. We weren't looking for it. People had no symptoms, but there's that little mass in the kidney. So people get these kidneys removed and find out they had cancer. So over 20 years, we've found a lot more kidney cancers. A lot more kidney cancers diagnosed now than 20 years ago. But the kicker is the same number of people are dying of kidney cancer now as they did 20 years ago. We're finding more cancers, we're taking out more kidneys, we're potentially causing more harm, but we have not changed how many people die of the disease. Early detection from these tests does not necessarily lead to lives saved. And that's the problem of screening tests. We do a test, we do more tests, we end up potentially causing harm, and we may or may not help people. The two best screening tests are probably mammograms and colonoscopy. And again, out of 1,000 people, maybe one person's life saved, which is good if you're that one person. But you have to understand the risks of all those tests. Every screening test has risks. I always say that a patient comes into my office and says, I want the works, give me an EKG, urinalysis, mammogram, colonoscopy, every blood test you can imagine. I want you to listen to here, feel my prostate. A lot of those tests, people get all those tests, end up being harmed more than helped a lot of times. But even if they are helped, the benefit is usually very small. The chance of benefiting from that is puny. Whereas if they lose weight and they exercise regularly, the benefit is huge. So rather than going to your doctor just wanting to get screened for all sorts of diseases that might be there, given all the imperfections in those screening tests and the fact that we can't always find the disease and sometimes abnormal tests lead to harm, given that, the best thing we as doctors can do for you is make sure that you stay healthy. I've been saying that all along. So my advice with screening tests, when you go to your doctor, just be honest with them. Ask them what the benefit and risks are, and you decide what's right for you. And that's all a screening test is, but please understand that when you get a screening test and it's normal, you still might have the disease. And if it's abnormal, you probably don't have the disease. It's not an accurate test. There's not a lot of screening tests that are very accurate, and a lot of them do cause harm. So just be wary when you do that, just like the PSA. Okay, take care. I'm going to enjoy my snow run. Hey, hope you like the podcast. We'll be back next week. I'm going to give you some information. If you want to check the website, if you want to email me, if you got your own stories, let's talk about it. See you next week.